am Dr. Asha Maradka, Professor and HOD, Department of Dravyaguna, Yenepoya Ayurveda Medical College, Mangalore. Today I am going to discuss about the Ekamulika Prayoga in managing Twak Vikaras. In Ayurveda, we have a huge resource of medicinal plants which are indicated in different types of skin diseases. We can use these drugs as a single drug therapy also. With a single drug, we can treat so many skin diseases. Specific learning objectives are to understand and identify the characteristics of specific drugs used in skin diseases, recognize the useful parts of each drug and describe their rasapanchaka, explain the therapeutic actions of the drugs including their forms of administration, appropriate dosages and anupana. The first drug is Aragvada, which is botanically identified as Cassia fistula, belongs to the family Fabaceae, subfamily is Caesalpinaceae, commonly known as purging stick. In Kannada it is called as Kakkemara, in Hindi Amaltas. The identification characters of this plant: this is a common plant which we can see in our surroundings. This is cultivated for the ornamental purpose, mainly because of its attractive yellow color flowers. It is cultivated in the gardens and also in the roadsides also we can see this plant. It is a medium sized deciduous tree, peripinnately compound leaves, and the inflorescence is racemose inflorescence which is hanging down in the pendulous form. The fruits are pendulous, glabrous and indehiscent. Initially it will have green color. When it gets matured, it becomes dark brown or black color. Useful parts are: leaves are used for the medicinal purpose, root, bark is used for the medicinal purpose, as well as the fruit pulp is also used for the medicinal purpose. The qualities of this drug is: it is having sweet and bitter taste, heavy for digestion and cold in potency, and post digestion effect will be having sweet taste. Due to these qualities, it has action on pitta and kapha dosha as pittahara and kaphahara. And this drug is identified as the best drug for mrudu virechana karma. Chaturangulo mrudu virechananam shreshtaha. This drug can be used as a mild laxative. It is indicated in different conditions. Here the concentration is on the skin diseases. In all types of skin diseases, all parts of the plants are collected, decoction is prepared, that is called as Panchanga Kashaya, and that decoction is used externally as well as internally. So, this Aragvada is available in the market as Aragvadadi Kashaya. And second indication is mainly in the case of wounds. Aragvada leaves are collected and they are made into powder, and decoction is prepared, and that is used for the washing of wounds. And third indication is in the case of Visarpa. The leaves are collected, made into powder, and it is mixed with grita, and paste is prepared, applied on the local part or the affected part. And next, in the case of Upadamsha, the root bark is collected and made into paste with the water and applied locally. The second drug is Chakramarda. It is identified as Cassia tora or Senna tora. This is also a common weed-like plant which is available in the roadsides and also in the wastelands. This drug is commonly found in the rainy season. Only the rainy season we can see this drug, and after rainy season suddenly it will disappear, and again in the next rainy season we can observe this plant. This plant leaves are also used as a vegetables, not the matured leaves. The tender leaves or the immature leaves are used as a vegetable. It belongs to the family Fabaceae, commonly known as Sicklesenna, Chaukuda or Tagachegida in Kannada. How to identify this drug in the field? This is an annual phoetid herb. There is a characteristic smell with this herb. This is a major identification character of this drug. And second one is it is having peripinnately compound leaves. Leaflets are and leaves are alternate, and flowers are seen in the racemose inflorescence. The yellow color attractive flowers are seen, and fruits are cylindrical in the straight or slightly curved pod. These fruits, when get matured, many seeds are available in the fruits. The seeds are dark brown to black in color. Useful parts mainly we use these seeds and then the leaves of the plant and the moola or the root of the plant is used for the medicinal purpose. This is another variety of chakramarda, we call it as Brihat chakramarda. This is identified as Cassia alata, belongs to the Fabaceae family. Both drugs are considered as Dravyaguna. Mainly the name itself suggests that chakramarda means it is mainly indicated in the ringworm infections. The qualities of this plant, it is having pungent taste and sweet taste, dry and light in nature, and the potency is hot and the post digestion effect is pungent. Due to these qualities it acts as a vata and kaphahara dravya, mainly indicated in Dadru Kushta. Dadru Kushta is, we can compare this to the fungal infections or ringworm. When the indications are explained by our acharyas, it is mentioned that it is indicated in all types of skin diseases, that is Panchanga Kasha, whole plant is taken and that is decoction is whole. When the indications, when the uses are explained in our classics, chakramarda plant, all the parts of plant are collected and decoction is prepared. That decoction can be used externally as well as internally in all types of skin diseases. And in the case of psoriasis, we can take the leaves of chakramarda as well as root of chakramarda along with the kanji, kalka is prepared and applied locally. And third main indication is leaves and seeds are made into paste and that is applied locally in the case of ringworm, and also in the case of ringworm, leaves and seeds paste is prepared and it is applied locally. And another indication is in the case of other skin diseases like Vicharchika Kushta, Vipadika Kushta, oil is prepared out of the seeds and that is applied locally. The third drug is Khadira. It is also considered as very important drug in the skin diseases. In Ayurveda, we gave much importance for this drug in the case of skin diseases as well as in the obesity and also in the case of diabetes. This drug is identified as Acacia catechu or Senegalia catechu, belongs to Fabaceae, commonly known as Kutch tree, khair or Kaggalli. How to identify this drug? This drug is medium sized thorny and deciduous tree with exfoliating bark in the long strips. Only in the matured plant we can see the feature of exfoliating bark, not in the young plants. And the leaves are compound leaves with the spines. At the base of the leaf in the axillary part we can see recurved spines. This is a major identification character of this Khadira. Identification character continues with the flowers, that is sessile flowers, pale yellow in peduncle axillary spikes. Pods are flat, glabrous, 3 to 6 seeded. The useful part is hardwood of this plant is used for the medicinal purpose, but nowadays it is hardwood is not available. Instead of that we can use the stem bark for the medicinal purpose. How to identify the hardwood? Hardwood is having dark brown color, reddish brown color, which is covered with the white color sapwood. The qualities of Khadira are, it is having Kashaya rasa, that is astringent taste and bitter taste, dry in nature, and potency is cold, as well as post digestion effect is pungent. Due to these properties it acts as a kapha and pitta hara dravya. Agre karma, according to Ayurveda, we accept this drug is best for kushta or any type of skin disease, or this kushtagna shreshtaha. In all types of skin diseases, this drug again it is indicated externally as well as internally. Decoction is prepared or the kalka is prepared, snana, pana, pralepa, pradehadi. External local application as well as internal administration is also indicated. And vrana prakshalana with kashaya, decoction is prepared with the hardwood and that decoction is used for wound washing. So, these are the drugs which are commonly used in skin diseases, and these are the chakramarda as well as the aragvada are predominant with anthraquinones and the khadira is predominant with tannins. So we should select the drugs based on the vitiation of the doshas. Ekamulika Prayoga emphasizes the efficacy of individual herbs' pharmacological properties in various Tvakvikara. Common forms of administration includes the decoctions, paste or powders with specific dosages and anupana prescribed according to the individual patient needs and the nature of the disorders. So we cannot finalize or we cannot fix the dose as well as the anupanas depending on the vitiation of the doshas as well as the diseased condition, diseased state. We can select the anupana as well as the fix the dosage forms. Bahya and Abhyantara Prayoga of Aragvada, Chakramarda and Khadira is mentioned in Ayurveda. Thank you.